Hello guys, hope you are all okay. Hope you are all enjoying and hope you are watching my videos regularly. Although I can see how many people are on the list and how many subscription I do receive and how many watch time I have got. So please keep watching my video. I need really watch time. That is very important. So I need really backup, I need acknowledgement. So that's why to keep my all these what you can say energies up, so that I should upload quite a lot videos for you. Especially this videos is respect to clarify a few confusion. I have received what I would say here, feedback, or rather I would say request, that one of my colleague, doctor colleague from India, he requested that I am still confused in three terms, that is debris, that is low level internal echoes, and that is clot. So I have got few of the images afterward, and I will explain that on the images as well, but here a few points I would clarify here to just clear this confusion. So far the low level echoes are concerned, low level echoes would be a homogeneous, and it will be evenly spread within the cystic lesion. So that would be considered as a low level internal echoes. Especially the example I would mention here of bladder. Sometime if there is some internal contents, or like if normally urinary bladder contain fluid, but if there is any pus or red blood cell within that, you can still feel, or you can still see some movable objects within, movable echoes within that, that would be called as a low level internal echoes. But the best example for the low level internal echoes is hemorrhagic cyst. If you see fresh blood in somewhere, that would be considered as a low level internal echoes. If you want to really check the low level echoes, so just look for a big artery and try to concentrate on, so you will find the blood movement within that. That would be called as a low level internal echoes. So far the debris are concerned, debris are more thicker, more dense than the low level internal echoes. So that would be from central sub centimeters, you can label that as a debris. So for the clot is concerned, clot happens to be more thicker, it could be in centimeters, it would appear as an echogenic, but it's again depend upon the age of the clot. If it is recently clot, so their echogenicity would be a less brighter, but if it is old clot, so then it would be a bit brighter. If it is within the cystic lesion, so the characteristic would be changed, and if it is in a solid area, so then the characteristic would be changed. So I'm going to try to clarify these 3 points: the internal echoes, low level echoes, the debris, and the clot on these images. So let's watch these videos, and let's watch these images, and hopefully this will help you to understand these 3 radiological patterns. Low level internal echoes. It's a radiological pattern. It's quite easy to appreciate on the ultrasound. In case of any confusion, compare it with the organ containing fluid, like compare it with the urinary bladder or compare the image with the gallbladder, and it will become obvious to you that these are the low level internal echoes. On this image, this is a cyst containing low level internal echoes suggestive of hemorrhagic content. Mind you that internal low level echoes major differentials include hemorrhagic contents or fibrinous contents. If you ever come across low level internal echoes within the lumen or any other area, think of hemorrhagic contents. Hemorrhagic contents will usually be associated with pain. On this ultrasound image, you can appreciate 2 images, and these are below the urinary bladder level. Look at towards the right side, there is a urinary bladder, and down you can see an image, and on the left side the same image is in slightly in transverse position. Both images shows low level internal echoes. This is another example of low level internal echoes if it appears slightly chronic. If a day or two has been passed on hemorrhage, so it will look like this. So this is again an example of low level internal echoes. This was actually a adnexal cyst, right adnexal cyst with low level internal echoes. Patient presented with severe pain on the right side with the menstrual abnormality as well. On the scanning, this image on this image you can appreciate there is a well-defined cystic lesion. So diagnosis was made as a right-sided adnexal complex cyst with low level internal echoes and suggestive of hemorrhagic cyst. So always look for the history and give its measurement on the report and ask the patient for the follow-up within 6 to 8 weeks. This is another example of low level internal echoes, but here you can appreciate one thing, like on the previous slide the low level echoes were slightly different, and here you can find the different pattern of the low level echoes. This is depend upon the age of the hemorrhage. The previous images shows that there was a slightly chronic hemorrhagic contents, not too much chronic that it convert into clot, but that was slightly it was 2 or 3 days old. But this one shows that there is some fresh bleeding going on. So this is the example of the low level internal echoes, which is likely blood, which is likely hemorrhage, but this is fresh blood. If you ever want to compare it with any other organ, so compare it with the urinary bladder, and the urinary bladder will appear anechoic, completely anechoic without any low level internal echoes. So it will become easy for you to appreciate the low level internal echoes. And normally if you want to appreciate the low level internal echoes, so use the linear probe and put it on any of the major artery, and then you will be able to appreciate low level echoes because the blood would be visible on that image. So this blood pattern and the low level pattern is quite similar, so it will help you to understand low level internal echoes in case of hemorrhage. On this ultrasound image you can appreciate two radiological patterns. One is low level internal echoes and another one is called as debris. Low level internal echoes can easily be appreciated if you compare it with any of the organ containing simple fluid like urinary bladder or gallbladder. So it will become clear to you that this image contain low level internal echoes. So far the debris is concerned, look at it is sedimented in the fluid in the basal area. Actually this is complex adnexal cyst having irregular wall with low level internal echoes and debris within it. So far the differentials are concerned for such type of radiological patterns. If you have both within the cystic lesion, the major diagnosis would be dermoid cyst. If this debris is echogenic and bright in appearance, so this would likely be the tooth or any other thing, but radiologically it will be considered as dermoid cyst. Or in other case you can consider it as a thick content within the lumen that could be slight or mild blood clot within the hemorrhagic content. So this is an classical example of low level internal echoes with debris, and that was diagnosed as a dermoid cyst in the right adnexal region. Debris are slightly thicker content than the low level echoes, and usually these gravitate downward because of the gravity effect and sediment in the basal part or in the dependent part. Look for this urinary bladder. In this urinary bladder, the upper part or supernatant part is anechoic, while lower a layer can easily be seen, that is debris. So debris is usually thicker than the internal low level echoes, so it becomes quite easy to understand between the low level echoes and the debris. Sometimes you come across both radiological patterns in one cystic lesion, or sometimes there will be single, like in this case it is urinary bladder and it has this content downward, and if you examine its urine, so you will see there are multiple RBCs and there will be multiple pus cells. But if you shake the patient or if you ask the patient to roll around, so this will again move from one side to another side, and beside this low level echoes will start floating within the lumen. So this is the example of the debris, and usually it is the thick part of the bladder, you can call as a clumps RBCs or clump pus cells or clumps neutrophil or leukocytes. So usually these appears in a form of debris. Here on this slide again a comparison has been given. You can appreciate on the right side there is urinary bladder with debris which is sedimented in the basal part and gravitate downward, and the rest of the area is anechoic, while on the right side on the left side you can see there is still low level internal echoes. So compare it with the right side supernatant part. So supernatant part is anechoic, there is no low level internal echoes, while on the left side there is low level internal echoes, on the right side there is debris. So these are very classical examples to appreciate anechoic lumen, to appreciate low level internal echoes, to appreciate debris. So when the patient's been through urinary examination, urine DR, so it was diagnosed as multiple red blood cells, multiple leukocytes and other urate contents. Again another slide for your better understanding. The same structure is here again. On the left side there are low level internal echoes, on the right side these low level dense echoes started gravitating downward and appearing as debris. So this is again debris and low level internal echoes. When the patient had been advised urine tests, so on the urine investigation it was cleared that multiple clumps of the red blood cell was present in the urine. Pus cell was also present in the urine. Beside this there was amorphous urates which usually sediment and appears as low level internal echoes if they are floating, or if they are sedimenting, so then it will appear as debris. So this was confirmed on the urine examination. So this is the radiological pattern, and here you can appreciate the difference between the low level internal echoes on the left and debris on the right side. On this image you can see blood clot indicated by yellow arrow. This pattern also look like mass, or you can call it as growth. Now the question is how we will differentiate clot from the mass or growth. For such differentiation, ask the patient to roll over or ask the patient to turn to its right and left side. Then you will be able to see the movement of the clot. If it slips to right and left side respectively with the movement, then it's definitely clot, and if not, then mass can be considered. So always be careful distinguishing between blood and intraluminal mass. So this slide is actually, it was blood clot and the patient had history of hematuria, and it is obvious here that this is a blood clot due to collection of the hematocrit within the urinary bladder. This is another pattern of blood clot. Here you can see this is urinary bladder, and within the urinary bladder fibrinous collection is there, blood clot you can see, but the blood clot echogenicity is slightly lower as compared to previous slide. Again, I would say here it depends upon the age of the blood clot. If it is acute, so it will appear slightly hypoequic like this. This is the acute blood clot. And if it appears chronic, so then it will look like slightly bright or echogenic blood clot. So do not confuse between that. You can always take the history, and there will be definitely history, and hematuria will also be there if it is within the urinary bladder, or if it is somewhere within the mass lesion, so the patient will give rise to the history of pain. There will be severe pain. And if this blood clot is within adnexal cyst or any adnexal region, again patient will be symptomatic and there will be severe pain. Whenever there is blood clot, there will be history of pain, there will be history of discomfort, and other relevant investigation will also help you towards the diagnosis. This is another example of the blood clot. Although this slide mimic as it is a distended uterus with intrauterine gestation, which is not the case. This is actually blood clot, and indicated by the yellow arrow. On the top of the urinary bladder, here you can see fibrinous layers. It means that there is obvious blood within the urinary bladder. Patient was diagnosed as bladder cancer, and after that, due to the instrumentation, the bleeding again occurred. So this is the blood clot, and patient came to the emergency with the retention of the urine because it is blocking the urethral orifice. And when scanned, it was confirmed blood clot. Patient has been asked to move to its right and left side, and obvious movements of the clot were visible. So on the basis of previous history, on the presentation of the ultrasound imaging and previous history of instrumentation, it was confirmed that patient has blood clot. Beside this, a urine investigation was done, and it come up with the multiple or cluster of rather I would say clumps of the red blood cell, so which was a great indication of the blood clot. On this ultrasound image, again blood clot is visible. Urinary bladder you can see clearly, and on the basal part there is blood clot. This blood clot hypoequic pattern shows that this is a recent blood clot. Although there is no internal echoes within the lumen, this is simply blood clot, and again patient has been asked to roll over and to move towards his right and left, which confirm that this is a blood clot. Although it looks like it is a polypoidal lesion, or you might consider it as a growth or mass, urinary bladder mass, which resembles transitional cell carcinoma. So be careful when you are differentiating between both. The one is totally benign entity and another is cancerous entity. So be careful and always use these maneuver to confirm between the blood clot and the mass. So this was confirmed that this was a blood clot. Previous investigation and instrumentation history also confirmed that this patient had a blood clot within its urinary bladder. This another last slide is for your understanding to have a look again for the blood clot. It is centrally, it looks like a polypoidal lesion indicated by the yellow arrow, and it is sharply within the center of the urinary bladder, evenly distributed from the both side, and you can easily differentiate the right wall of the urinary bladder and the left wall of the urinary bladder. And the only maneuver is that you roll over the patient. You ask the patient to take the right decubitus position and scan the bladder. So you would see obviously movement. This blood clot will gravitate towards the left side, and then after that perform the another maneuver. Ask the patient to roll over or to have the left decubitus position, and you will see that the blood clot will gravitate towards the left side. So by this gravitational changes, the blood clot could be confirmed. Always ask the patient for the previous record, always take the history, always ask the urine color, look if there is any urinary report, urinary test report is available to you, any previous urinary infection, kidney infection, and especially if the patient is older, look for any instrumentation or previous urinary retention. So there will be catheterization, especially post catheterization cases. There is always blood clot within the urinary bladder.